back to my channel, Tribe Nursing here. I found a pretty interesting article that I would like to talk about. This article goes back to, it was released on December 23rd, and it's per the CDC, although the CDC has not updated their guidelines yet. They will be doing that shortly. So, due to the increased amount of Omicron variant COVID cases that have been reported within the United States, per the CDC, what they are saying is that the new guideline cuts the quarantine time from a previously recommended 10 days. So if you are a healthcare worker, pretty much what they're saying is that if your hospital is experiencing staffing shortages due to COVID, healthcare workers who have been fully vaccinated, including a booster, do not need to quarantine at home anymore following high-risk exposures. So pretty much what they're saying is that if you are a nurse or other healthcare or any other healthcare worker, from according to this article, you are to report to your job, provide patient care, even though you are asymptomatic with COVID. Wow, right? That's a lot to take in. So, what does this mean for us? That you are asymptomatic, you should report to your job to provide patient care to patients who may or may not have COVID. So, it has been proven that patients who are asymptomatic can spread the COVID, can transmit COVID. Now, how does this make sense? We are healthcare workers trying to fight off COVID. Now, per the CDC, they are requiring that healthcare workers go into the field and provide patient care to patients who may or may not have COVID. Now, therefore, healthcare workers can potentially spread COVID to non-COVID patients. This is absolutely terrifying if I was a patient. Let's start there. If I were a patient going into a hospital setting, knowing that I do not have COVID, let's say hypothetically speaking, I tested before going into the hospital, I'm COVID negative. Now my healthcare provider is caring for me that has COVID, that is asymptomatic, now could potentially spread that COVID to me, I would be pretty upset. CDC, within the last couple years, due to this whole pandemic, they have been getting a lot of backlash due to certain topics related to COVID and the pandemic and how they've been handling it. Now, this article that I have been seeing, now hear me out, I have been seeing this all over social media, such as TikTok, Instagram, so I thought I'd share my point of view. I don't think it's right, in my opinion. Healthcare workers are already one step out the door. They have one step foot in, they have one step out. They are already ready to leave the bedside. As of reports of 2022, it is expected that 500,000 nurses are to leave the bedside. Now, how does this make sense that hospitals are going to begin to require nurses to come into the hospital to care for patients because due to a shortage? Well, that's not going to help any at all, first of all, because those nurses are going to leave because they are just sick and tired of everything that's happening. So it's just making the matters worse. So that's the first thing. The second thing is that I've been hearing rumors about how certain hospitals within Illinois are requiring nurses to provide stamps or stickers on their badge reels to show that they are vaccinated or not vaccinated. Now, this goes against the HIPAA law of 1996. This is a total HIPAA violation for healthcare workers to deem whether or not they are vaccinated or not. So this is just causing a huge snowball effect that it's going to get to a point where nurses and other healthcare workers are just already done. You know, healthcare in general is already a stressful career choice, no matter what position you are in. Now, add on top of COVID within the last couple of years, it made things a lot more stressful. Add on CFOs, CEOs of hospital administration not caring for healthcare workers within the field. Adding on the uncompensated healthcare workers, the unsafe patient ratios, the patients that require extra amount of care, this leads to burnout. What are we gonna do, folks? This is absolutely ridiculous. Now, what do we do now? What can we do going into 2022 to make things a little better? Well, first off, I would say if your hospital administration, CEOs, CEFOs are not listening to you, you know, follow that chain of command. If no one is listening to you, call your congressman. Write a letter to your congressman. I already have. I already wrote my letter to congressman explaining the whole entire situation. I'm pretty sure they are aware of it too. Not sure why anything hasn't been done yet. Another thing you can do is try to find a way to start a union within your hospital, at least. If you are willing to stay within the hospital setting, you are happy where you are, but you're just not happy with the settings of where specific situations are currently, that healthcare workers are currently facing. Try to start a union if you are happy with your staff position. Another option you can do is that you can start travel. You can do travel, make the money that you deserve, because we all deserve to be compensated from the work that we provide. Here's the thing, CEOs, CFOs, they don't care. Hospital administration, they don't care. You can drop dead tomorrow, and they will probably send your mom a bouquet of flowers, if that. Send a nice email through your work email to all hospital staff. But the one thing is that you are replaceable, and that is something that you need to keep in mind. If you are able to be replaced within a hospital or within any kind of setting, how important are you to this work setting that you provide, that you spend most of your days in? You spend most of your hours in. You spend most of your time in with these people that you work with rather than your family. You spend more time with staff versus your family members. The staff is great. You know, it's never about the staff, in my opinion. It's more about the higher ups, the hospital administrations, the people who are providing the pay, the people who are providing these rules and these ridiculous situations that are causing healthcare workers and especially nurses to leave the bedside and to just leave either healthcare in general or go do travel. So I just wanted to share my insight about this. I'll leave a link to the article that I have found. There's quite a few articles, and it's a trending topic as of right now within the healthcare setting. I'll leave a couple links to the articles within the down below, so you'll find it. And with all that being said, leave your comments down below. I'm super curious to hear about what everyone thinks about this. You heard my point of view. I'm not a fan of this whole thing. This is just not right. It's causing more people to leave the bedside. So, oh man, well, I don't know. We'll figure something out one day, right? Like I said, my name's Tribe Nursing. I make all nursing content, lectures, nursing skills. If you are new here, feel free to subscribe. Please subscribe. It actually helps the channel out. I make videos like this all the time. Actually, this is actually a new playlist that a new type of video series that I have began that I'm actually really passionate about, and I'm actually really into speaking about these topics now, because I never knew that there's so much politics behind nursing and the healthcare field. But I'll make a whole separate video on that. Thank you guys for watching. My name is Tribe Nursing. Have a great day and peace.